Okay, so this is my next video. I am about 8 weeks away from having surgery on my mitral valve for a repair of my mitral valve for having severe regurgitation. You can look at the rest of my videos and subscribe to see my journey through my diagnosis and what changes I've had and where I'm at and everything. So this video, I'm going to talk about how I'm preparing for my surgery and what I'm going through emotionally and physically. So I'm still on 20 milligrams of Natadol, 2.5 of lisinopril twice a day, Natadol once a day at 20 milligrams, and a water pill. These are keeping my symptoms to keep my heart at an okay level to put me off because I don't want to have surgery until November because I can't miss work. I can't afford to miss work. And my cardiologist said it's okay as long as you're on these drugs and your heart's not overworking, we're good to wait. But this is the prime time to do the surgery because now I have like mitral valve thickening and my ventricle's good. So he wants to do it now before it gets worse. So my surgery will be in about 8 weeks, and I'm scared. I've been watching YouTube videos, and I'm not doing it to scare myself. I'm doing it just kind of to prepare myself because I'd rather be over-prepared, and because when the time comes where I'm actually, getting ready to get the anesthesia, I don't want to be like, oh, I forgot to do this, or I want someone to know this. Um, so I knew I had to have the valve surgery. And I love my cardiologist. He is so thorough, and his bedside manner is so calm. And if it wasn't, I would have picked another doctor right away. But this guy, like, he took his time. He's older, so I like that he has a lot of experience. Um, what else do I like about him? There's other doctors in his practice, so if he's not available, I can always get an appointment with someone else in the practice. If I'm having um, something I'm worried about and I want to get in right away, it's never an issue. Um, let's see. I have insurance, so I'm not paying out of pocket for anything, which is a huge help. He takes my insurance. Um, let me see. He's the kind of doctor where he doesn't take chances. If I'm having a symptom, he wants to do all the tests he can to find out what's going on. He's just very, very thorough. Like when he listens to my pulse, he puts this stethoscope all over to my ankles, my everywhere, just to hear, I guess, and listen to my pulse everywhere. Um, the tests he's had done so far are echocardiograms, transechocardiograms. He did a heart catheterization at one point just to make sure I didn't have a blockage because I was having some shortness of breath, and he wanted to make he just is like, maybe it's over the top, but I'd rather have him checking everything out than not checking out and having something go wrong. So I like my doctor. Let me see. I should have made an outline again. Okay, so I'm watching videos because I want to know what the surgery entails. And I do go back to him on November 10th, and that's when we're going to schedule the surgery and do any pre-testing or anything else I need done at that time. So when I'm watching other people's diaries, I'm seeing people that had surgery like years ago where they still broke through the sternum and went that way. I found a recent video from a surgeon, and I'll try to find the link again and link it here. And what this surgeon said was that, I don't know, there's some kind of mini or micro, but they still go through the sternum. And he said that's the most accurate, best way to do it. And yeah, the recovery is longer than if they go through the side, through the ribs. Um, but it's more accurate. and a better, I guess, a better result in the outcome. And another thing they do that the surgeon on that I found on YouTube that I linked to, what he doesn't like doing and what he won't do actually is the robotic surgery. And I guess from what I'm seeing is the surgeon has his hands like and controls some robot arms that are actually micro and in you, and this, it's like the robot doing the surgery. The surgeon's still doing the surgery, but he's not touching the tools. These robot arms are touching it. And what the surgeon on YouTube said was wrong with that, or an issue with that, some things that happen, and I don't know the exact statistics, but what happens is with that is it's not as accurate as the surgeon's hands. So sometimes the robot arms uh, move too quick and will break this vein or tear that. And so now the surgeon has to fix this or fix that because the robot arm did something. So what the surgeon was saying is do not go to a surgeon that does that type of surgery. So that's one of the questions I have to ask my surgeon when I go back, to ask what kind of surgery is it? Is there a robot involved? Is it through an opening in my ribs, less invasive, or do they go through my sternum? These are questions I have to ask at my next appointment in November. And so another way I've been preparing is finding out what's going to happen during the surgery. No matter what way they do the surgery, finding out that I will need to be on a heart and lung machine, which I wasn't aware of until I read. And what that is they actually stop your heart, and they have a machine that pumps your blood for you. So, all the blood and oxygen will go to your organs as it's supposed to while your heart is stopped. So they'll stop my heart while they do the surgery. And then what I'm seeing from videos, again, I'm learning this. I didn't talk to my doctor about this yet because I trust him completely. I'm just figuring whatever he needs to do, he needs to do. So I'm trusting his judgment on everything. So they'll put me on the heart and lung machine. And then when I wake up from the surgery, I'll wake up in ICU, and I'll still have this heart and lung machine on me, and I'll have a tube in my throat for my breathing. And people are saying that when they wake up, the first thing they do is freak out about this tube down their throat. So I'm gonna tell my husband ahead of time, because he'll be with me when I wake up, to you know to ask the nurses to get this tube out as soon as possible, because I'll be uncomfortable and I won't be able to express that I'm uncomfortable. So I told my husband that, to make sure that's taken care of. And I guess I'll have a pacemaker. And what the pacemaker's job is to keep my new fixed heart beating at a regular beat, to make sure it's beating and it doesn't stop. So in ICU, they keep me and monitor my heart through this pacemaker to make sure that my heart's beating on its own and not having any issues. So it sounds like I'll be in ICU for a few days, and then I'll be in a regular room for a few days. And what I'm seeing from other people's post-surgery videos is, across the board, the sooner you get up and walk, the quicker your recovery is. That people don't like to be on the painkillers because it makes them groggy and they feel out of it, and it's not actually helping. It's not helping them recover. It's just helping them not be in pain. So people are saying that, while you're on these painkillers, get yourself out of that bed and get walking as soon as you can, and get your heart working, because the sooner you have your heart working through exercise, even if you're just walking across your hospital room, and then just going to the bathroom and coming back. And then maybe you'll walk out to the hallway and back. And then maybe you'll walk down the hallway and back. But across the board, everybody's saying that the more you exercise and get moving, the quicker your recovery is. So that's what I'm planning to do. So the other things I'm planning to do are to get my things in order, so to speak, in case something goes wrong. And I'm also doing this for work. I'm not just doing it in case I die. I'm doing it because I know I'm going to be out of commission for a while. So what I've been doing now is, while I'm on these meds and my blood pressure's low and my pulse is slow, I'm a wedding photographer, and carrying my equipment, I'm getting tired because my blood pressure is low. So I've hired assistants to come with me just to carry my gear. I'm fine to do my job. I'm not in any trouble that way at all. But I want someone with me just in case, just in case I get more tired than usual while I'm covering a wedding. But that hasn't happened, and probably won't happen, but that's something I've done to prepare. I've made notes on my clients that I have up until my surgery. So this other photographer is aware of who my clients are and where my files are and what the status is of upcoming clients. Just in case something happens during surgery, I am going to draw up just like some kind of what my wishes are. I hate that I even have to do this, but this is something that people should have in place anyway, because you never know when something's going to happen. Not even having heart issues. I could have a car accident, and God forbid I'm not here tomorrow. I want to know that my kids are taken care of, and that I want people to know what my wishes are for them. So maybe I'll make a video of that, of what I don't think I will, because that's probably private. But what I want to discuss here is that it's something I'm doing to prepare. So I'm going to prepare. I'm going to say, this is my house. This is what I want done with it. This is what I hope for my kids. If I can't be there with them for the rest of their lives, this is what I hope for them. This is really hard, and I'm trying not to cry talking about this stuff, but it's something something that I know I'd rather have this written out and taken care of now, so I'm not worried about it going into surgery. I just want everything taken care of and written down, so I'm not worried about it when I go into surgery. So this is a normal thing to do, and everyone should do this before surgery, because it's going to make it less stressful, the week of the surgery, to have everything planned out. So I plan on doing that probably this week. And I think that's about it. I might not make any other videos until the week of my surgery. My next video will probably be discussing what happened at my November 10th visit, which is my last visit with my cardiologist before the surgery. I don't plan on seeing him before that unless I have any symptoms that are worse. So this is where I'm at till then. Thanks for watching, and look for future updates. Thanks.